name is Janet Nyaga, nutritionist working at level 5. With me, a colleague who is going to discuss a few things pertaining nutrition in Renal. Kindly ask her to introduce herself.
Thank you so much, Janet. My name is Renal, a nutritionist working in Consolata Hospital, Kieni. It's in Embu County, Runyenje sub-county. So, as you said earlier, yes, we're going to discuss about nutrition in Renal. Yes.
Renal, what do you understand by chronic kidney disease?
So yes, kidney disease is the impairment of the kidneys and their function. The kidneys stop functioning as they should in a normal person. Majorly, that is what, in a simple way, we describe kidney disease is.
What nutrition care do you give to a patient when they come to you with chronic kidney disease?
So, with patients, nutrition care in kidney disease is very individualized. You don't do things as a group. You use the individualization of each patient because each patient comes at different kidney stages. It is good to understand that kidney disease is staged from stage 1 up to stage 5. And in those stages, we have different management for each one of them. So in the management of kidney disease, the management is different pertaining each patient because one, you personalize these things depending on the stage of which this patient has come with. Could be from the staging is done from stage 1 up to stage 5. So you'd find that the management you give for a stage 5 patient is different from the management you give for a stage 3 patient. The management is personalized depending with even the lab results that will give you a go-ahead on what kind of management to give and to even show you if you're going to do some restrictions in the diet for this patient.
What dietary advices do you give to your patient who come with kidney disease?
So as I said earlier, when managing a patient who comes to you with kidney disease, you personalize everything for them. Their diet might differ from another patient who is suffering from the same kidney disease. On this note, it is very important to work with the lab results that you get and also to do the nutrition assessment for this patient. One, you will be required to do the anthropometric assessment, and in this case, you should be very careful with this patient because some of them present with edema. So if they present with edema, after the session of dialysis, you should be able also to do the weight again after dialysis because there will be fluid loss, thus there will be weight loss. So I'll take you through the renal diet management. And before I take you through the management, most patients feel that the diet is very limiting because most of us nutritionists would like to keep on telling the patient the don'ts, which at times makes the patient feel like you have left them with actually lesser options for them to feed on. That is why when you're giving your advice as a nutritionist, you should avoid starting with not, rather start with what they should do. Yes. So our number one focus is to lower blood pressure. We all know that sodium regulates the amount of water in the body. And now remember, the kidneys have already failed and they cannot remove these excess fluids in the body. So what happens is that there is fluid retention in the body. And if there is fluid retention in the body, that is why this patient will come and present with edema, right? And so you will want to reduce the levels of sodium in the body. And how you reduce these sodium levels in the body? One is by reducing the dietary salt intake, the normal table salt. That one is the first thing that we should eliminate from the patient's diet. Secondly, tell your patient that even other salt options, like the ones sold in the supermarket, people commonly call it sea salt and they think that it is a healthy option of salt. Tell them that also that one is not an unhealthy option because it also contains an amount of sodium. Canned foods, they also contain this sodium because of the preservatives in it. In renal patients, you also want to limit or lower the intake of potassium. because remember that kidneys filter out all the waste from the body. This waste comes from what we eat, and potassium is one of the waste that is excreted by the kidneys. With impaired kidneys, the filtration rate goes down, and so there will be some deposits of potassium, and that is why in some instances when you check the lab results, you will find that sometimes a patient may present with high levels of potassium, and when that happens, you need to lower the dietary intake of potassium. This is where now you will advise your patient on which foods that they will take that are actually lower in potassium. This is where we also advise the patient on leaching foods like meat and even vegetables, so as to remove the excess of potassium in it. Dietary options of foods that are lower in potassium, especially like fruits, we will give this patient an option of like apples, give them an option of berries or pears, because bananas are high in potassium, mangoes are high in potassium. As I said earlier, it is not good to start with the don'ts. So first begin with what patients can eat before denying them the other foods. And in the leaching process of vegetables and meat, it is also good to explain to this patient why are they leaching these foods, because most of them just think the doctor said so, I should do it. And it is actually good when the patient does something from their heart, knowing the reason behind this, and they will have better compliance even with their diet advice.
We've discussed about leaching vegetables. We find out most of our patients that we encounter, they believe that they are only supposed to take white meat. How will you explain that?
Actually, that has always been an issue to most patients. When they go to different hospitals, some nutritionists say, do not take red meat, just do white meat. And that is what I say, that we are so emphasizing on the don'ts, and you don't give that patient the reason as to why you're saying that. One thing is that the red meat is not actually prohibited for the eating of patients. They should leach that meat just like they do to the vegetables, so as to remove the excess of potassium. Yes, that is not very good.
Most patients with kidney disease present with malnutrition. How will you explain that?
Okay, you find out that malnutrition sets in mostly because there is lowered appetite for these patients. Again, these patients are also undergoing psychological stress, and you find that their feeding habits have also changed. It is also important to note that as a nutritionist, you should work a diet plan for this patient that includes all the calories required, so that this patient does not get into malnutrition. Also, we find that also patients who have too much restriction of the protein will also cause this patient to have what we call protein energy malnutrition, and they will present with thinning and muscle wasting. Remember that every time this patient undergoes a dialysis session, they lose protein. And so we say that a patient who is going through dialysis, their protein requirements differ from a patient who is not undergoing dialysis. And so as a nutritionist, you should be able to work with individual needs for this patient. Ensure that they get enough protein depending on their weight, depending even on the sessions they go through for the dialysis. Ensure that you calculate for these patients their energy requirements for each day, and remember that their energy requirements, also remember to include the stress factor, because these patients are psychologically stressed, their bodies are going through a catabolic state, and so they are losing energy, they are losing protein through the dialysis session.
So Winnie, thank you so much for sharing with me. Thank you for your time. It was a good session. Now, what are your parting shot?
I would like, as my parting shot, I would like to tell nutritionists who are out there to know that they are of great importance in the management of most of all these conditions that we are encountering nowadays. Make your patients feel happy after having an encounter with you. Let them know why they are being told to do a certain thing. Let it not just be you say, let also them say something about what they feel, and you will get good results when you work with your patient, because once they understand, most patients are actually ready to cooperate and they are much willing to do something that will improve the quality of their lives. Yes. Thank you for having me.
Thank you.